hello, and on the other side it said, Enda Vishesham, Endonda Vishesham.
Good nursing care TMM always had.
And here, my goodness, how can you do that?
I am coming from India, I need to speak to him.
I think that was in 1978.
Friends of nuclear medicine is also in the full swing.
He interviewed me from the US. He was acting medical director at that time.
He said, oh, I didn't realize that.
It's a big surgery, depending upon the size.
Came out of the surgery thing because even the staff man thought it was very important.
Today we are here to talk about probably the first man to have done urology surgery, endoscopic urology surgery in Kerala, Dr. Kunjappan John. He was the pioneer of urology, not only for this central Travancore, probably in the whole of Kerala. That was the first TUR done in Tiruvalla Medical Mission. He brought his own instruments from the United States, and he introduced the specialty of urology to this area.
I think that was in 1978.
Yeah, that is in 1970.
The first TURP was done.
Yes.
So wasn't the date the department was started in TMM?
He started the department.
70,
Actually,
I think 1976 he started the department of urology in TMM.
There was no specific department. It was with surgery.
Okay.
Then he brought in this specialized surgery, and slowly Dr. Sundarlal Babu came in when he left for the US.
So he was also a urologist?
He was a urologist. Yes. He was from Vellore. He was coming, I think he was here before full time. Then he went to Ernakulam. From there he was coming weekly, twice a office. I came in 87. He interviewed me from the US. He was acting medical director at that time. And I had just finished my MCH, and I was sitting at home. Then I saw one vacancy there, so I just called here, and then he interviewed me from there. That's how I joined in 87. That time he was in US. He used to come once in a while. Then over the years, the department developed into what it is today.
So will you be able to recollect your experiences while you just joined TMM in 76?
Can you tell about the first TUR you did here?
Yeah, that's right, yeah. It was very intriguing to me as a young fellow to see that what was being done by open technique to take a prostate gland, it's a big surgery, depending upon the size. And though that is and here, my goodness, how can you do that? So in William Beaumont, when I was starting urology there, they themselves was surprised, that these things could be done that way. But even there, that also, even to put that even in the second stage, there we did a kidney transplant from one person to the other, and so I said this is a big thing that we can do because there are two structures. We need only one-third of one kidney to function a human body. And here you can, so much waste is there. So that we have to know how to do and how effective that would be. And so they themselves cooperated with me in William Beaumont Hospital, which is a very big hospital, and where I was doing the training. And then, and it progressed. And even this time, when I saw Harry Liquid, who was the urologist there, he said hello to me. He was saying, Harry. So it's very interesting how things develop and in medicine, and particularly in urology, because of this, the two kidneys, as I said, that, you need only 1/3 of one kidney to function a human body. And therefore, why don't we give a kidney? I said, I can give kidney if it to suit them, so that to find the suitability, and was the important thing. So that's how it developed.
I think right now he remembers more about kidney transplant.
Yeah,
But the kidney, you did some kidney transplants there, but we didn't do any kidney transplant in Tiruvalla. So what you developed was transurethral resection of the prostate, and Dr. Prem had that question, how did you develop that? And what I can remember, I can tell, and that is that actually we came to TMM hospital in 1967, I think much before you were born. So when we came to Tiruvalla, it was a very, it was more like a village. It was not a developed place. As a matter of fact, if I needed eggs, I had to tell somebody in the village, will there be some eggs for us? And if they had a hen and they could give me eggs, that's how we got our eggs. They were only ambassador cars. People at that time took buses to come to the hospital. A lot of people walked. The only bakery that was famous was Best Bakery.
Best Bakery.
And, we didn't know any other bakery. So this was the context in which we had come. It is not what it is today, with skyscrapers and bakeries galore, and just a beautiful place, very developed, with 2 medical colleges and universities, colleges. None of that was there. So it was in that context that we had come. At that time, Dr. John was a surgeon. He was not a urologist. So what he did mostly was general surgery and even orthopedics. So he did a lot of orthopedics, general surgery. While he was doing the general surgery, prostate patients came. And then he would do an open surgery, take the prostate out by a surgical procedure. And after the case, we would have to have the patient be in the hospital for about 5 to 7 days. And sometimes you would need a unit of blood to be given. So it's a big procedure. While he was in US, he had seen people do transurethral resections. And it was like a 45-minute operation. The patient goes home the second day. There's no incision. And a much, much less invasive operation. So he remembered that and he thought, okay, that's what I think we should do in Tiruvalla. So we both went back in 1971. And then he did a fellowship in urology. That's when he became the urology specialist. So after doing his fellowship at that time, I did my anesthesia, and we came back in 76 or something like that, so, late 75 I think it was. And that's why Dr. Prasad said that it was in 76 the urology department came. When the urology department was to come, of course, again, India was different. We did not have medical equipment in this country. I mean, we couldn't buy it. Either you bring it from abroad or you don't have it. And there was customs and duty and all that. But by God's grace, with the help of others, Dr. John was able to bring a lot of instruments, which consisted of cautery machines, TURP, telescopes, cystoscopes, and that is how he got started, and that's how the first operation was done in 1978, I believe.
78.
Yeah.
And she
So that's
used
the
to
beginning of urology here.
And she was helping with the anesthesia also. And she would give anesthesia, and I'll do the TURP. And so I used to say, she presides, I perform.
And another thing very interesting, which you will not see today, when we did the TURP, That was the first operation that was done by electricity. Before that, all the other operations you do, you cut and you tie, and that's how most operations go. But with TURP, you put a telescope into the bladder, and then you use those blades to kind of scrape the prostate. And when you do that, there is bleeding, and you stop the bleeding with a machine called cautery machine. So we had all that, and that was good. But the way the electricity was, it would go off all the time. So he'd be doing surgery, and the electricity would go off. And now what do you do? I mean, if there is a bleeding and you have an open operation, you can put a hemostat, you can tie it. But when you are doing it with a telescope, you can't do that. So you have to still stop that bleeding. You can't let the patient bleed. So the way he used to do was that when you have the catheter in, it has a balloon. He would dilate the balloon, and with the pressure of the balloon, stop the bleeding. Wait till electricity comes back, then restart the procedure. And then, of course, there was a concern, how long will the anesthesia last? Because if the electricity went 15 minutes, and he was like 15 minutes in the case, you add another 15 minutes to the 40. So it may go on for 1 hour. And then you were a little worried, will the anesthesia last or not? Or what do we do to extend that anesthesia? So those were the things. So that was a challenge. And so then he thought, we have to take care of that challenge. And that's when we got the first generator. So that the rule was, if electricity goes off, we had just one generator. That generator will be put on, and it will only be used in the operating theater and no place else. But with regard to that, I had an interesting story. I don't know whether it was in your time or not. Because he was the only person doing the TURPs, we got patients from all over. From Trivandrum, from Kannur, from Calicut, and all over. And there was an electrical engineer here, and his son needed this, he needed TURP. So he came to him for the surgery, and he asked Dr. John, he said, and he explained everything about the surgery, how long it will be and such like. And then he asked how much time it will take. And so he told the engineer, I can't tell you about the time because the electricity goes off in this place all the time. And it all depends on your department.
Yes.
So he thought about it and he said, oh, I didn't realize that. He said, Dr. John, you just call me and tell me in the electricity department that you are doing a TURP, and I'll see to the fact that the electricity does not go off. And since then, he kept his word, and we did all the TURPs. We always called the electricity department, and electricity didn't go off. He didn't do it for other operations, but for TURP he did that. So that was quite a good thing, and I think community just had a good feeling about it, that this is something that has come, and it is a help to the community.
I think if I add to what Dr. Vimala was telling, my grandfather was operated by him. I think sometime in 79, 82 or something like that. Yeah, before you left. He was also at that time around 90 years or 89 years. And he lived for another 5 or 6 years without any problem. I still remember that.
Yeah. God is good, and I think this all happened not because of anything special in either of us, but it was God's grace and it was God's goodness that he had the experience, that he learned that he was able to bring the instruments, and we had a very good team of people here, our nurses and other people who cooperated very well. I remember, and I think Dr. Manak will remember, that both you and him seldom had lunch on time. I mean, the operations just went on and on and on, and it may be 3 o'clock before they will get a bite to eat. But it was good days, and we are really very thankful.
Yeah. And in States itself, where we were working in Michigan, and it's like a thumb in part like that, with a leg here and leg here also to some extent. And so this is, in order to get there, you have to make it possible that the doctors function there. So the 4 hospitals there, I said to them and to the surgeons, if you will cooperate with me, that you follow the patients, if it is not serious, then I'll do the operation in your hospital. So that is 4 hospitals I used to go from one place to, and for that I need to do flying. And my experience in flying has even exceeded, and I had total, I put about
1,400.
1,000 hours.
400 hours
For
flying.
100 hours in the air, and so amazing it was that this can be done.
I think you used to go for flying to some places, either Mysore or somewhere. Or
Yes. Yeah, when he was in India, sometimes he used to go to Mysore to find a small plane.
to fly.
4 hospitals I used to go flying like that, and many people don't have that much experience even in flying. But because it was delectable, and told them, the doctors, to cooperate, so we were able to do this, and by the grace of God, we did not have any problem.
There were times that we worked together. I think you were there and I was in the operating room.
Yeah. After you came back, you were there.
Yeah.
Yes,
That's
yes.
what I was saying. Yeah.
You were in the theatre.
Yeah.
I remember, നമ്മുടെ Alexander Marthoma.
Yes.
We did a cystoscopy on him. And you
Exactly.
gave the anesthesia.
Yes.
He's no more, actually. He's your
Cousin.
uncle.
My first cousin.
Yeah, first cousin.
First cousin.
My mother's brother's son.
That's right.
Yes.
We did a cystoscopy on him.
Yeah.
He was the Marthoma Savada.
yes,
And then she gave the anesthesia. Also, a few other people will give you give anesthesia for a few.
Yeah. I think the people I remember that may be of importance are Pailiachan from
നമ്മുടെ
Ernakulam, Jeej Kutti's father.
Gemini's father-in-law,
Gemini's-
ABA's father.
Yes, that also.
Orthopedic.
Then I think you took care of Mr. Laurie Baker.
I
from
was
Trivandrum.
You
were
wonder,
there
you
for that.
trained
He was
that.
in the government hospital.
Yeah,
in
he was in the
Trivandrum.
medical college.
Yes.
And he was shifted here from Trivandrum.
I went and
Yeah,
got him
he personally brought.
Yeah.
And we both of us together opened.
Yeah.
He had actually a cholecystectomy. Then he developed a subhepatic collection. He was going on having fever.
Yes.
But they are not doing P.A. Thomas, I think he was treating. So he went and brought him here, and we opened up and drained this
The subdiaphragmatic abscess.
subdiaphragmatic abscess.
Yes.
That's right.
We both did it together. After that, he became okay.
Yes. Yeah, that was a good one. Then
You
later,
know who Laurie Baker is? You know?
and then later he came for TURP also.
Yeah, he came with you.
Yes.
And he built his house.
Yeah.
Which one?
This house.
At this house. No, he's in Trivandrum. I studied in Leveler School. A lot of buildings in that school are built by him. His lot of his construction is different.
Baker House.
Here only bricks and things like that. Some walls are double. This air in between, so
Yes,
that
yes.
it's always
Air
very
was
cool.
always very
Our
important
auditorium in
point.
our school was built by him. It's very cool inside.
Yes. The other person was E.P. Varghese from Thrissur. He came. Some minister, I think a minister by name Mr. Gulati from Trivandrum came.
Trivandrum.
You know, I think may have been at the time you were there.
At
too.
the institute.
So a lot of what
Economics.
I said was also before Dr. Manak's time, because he only came in 87, whereas we came first in 67. There were periods of time, like 4 years we are here and then we were gone to US. So there were periods when we were here and periods when we weren't here. The time when Dr. Manak was interviewed on the phone was the time. At that time he was in US, but after that he came for some times and they worked together.
Yeah. After that, after he came back, we were together for quite some time.
Because I remember working a lot with you. The reason we came here is right after our medical studies in Vellore, he went to US. I still had to stay back because I had another year of internship to do. So a year later I joined there. And then I did my residency and he did his general surgery, as I said. In those days, again, things were a little different. When you did general surgery and he did it in a county hospital, general surgeon did everything. You know, colons and stomachs and gallbladder and some hysterectomy, some fracture repairs, everything. So when he came back, he was fortunate enough to have had all that experience. So when we came, Dr. Davis was here, Dr. Gilmore Davis. He was from England and Canada. His father was Welsh. He was a missionary, Mr. J.M. Davis, who was in Thrissur. And Gilmore was J.M.'s son. So they were looking for somebody to help with surgery. I have no idea how Mr. J.M. Davis knew about us. You know, through his many conversations with people, he knew that we were in Michigan going to a church, a Brethren church. So, he used to travel, and when he was traveling in Michigan, this was very interesting. He was traveling in Michigan, and if you remember J.M. Davis, he spoke better Malayalam than Malayalis. He used to translate for Dr. K.M. Namboodiripad. So, anyway, J.M. Davis was in Michigan. One day, he was told that Dr. John is there and that he works in this particular hospital. It's called Highland Park General Hospital. So one day he was assisting in the operation with the staff surgeon there. And then a phone call came. And it said, Dr. John, there's a phone call for you. And so he said, tell them I'm in surgery. Take the number, I'll call back. But if you know Mr. J.M. Davis, he's a very persistent man. And so he said, I am coming from India, I need to speak to him. So he said, okay, in that case, he came out of the surgery thing because even the staff man thought it was very important. So he came off, and as it is the custom in the OR, the nurse holds the phone for you and you stand with your hands in front and you answer the phone. So he said, hello, and on the other side he said, Enda Vishesham, Endonda Vishesham, he heard.
Okay.
Who is saying Endonda Vishesham in Michigan? And he said, Korpavella. So he said, okay, I am J.M. Davis and I am here and I'd like to meet with you sometime. And so he said, okay, Mr. Davis, I'm right in the operating room right now, but, you know, this is my number for the home. We'll meet you. So then he came home and he had some dinner with us. And then he said, you know, we are looking for somebody my son is Gilmore Davis, who's the surgeon and superintendent of TMM, and we are looking for somebody. And what is your plan? And he said, we didn't have any plans. So he said, when do you finish? And then they talked about it. And so that is where he put the seed that please come to Tiruvalla. Then Mr. Gilmore Davis wrote to him and said, you know, I hear that you're finishing your residency. Would you consider coming to Tiruvalla? So then we prayed about it and we thought maybe that's what God's plan is, and we decided to come to Tiruvalla as a surgeon. So that is why we were here in 67 as surgeon.
When you joined, was Dr. Jacob here?
No, after that, we knew Dr. Jacob from CMC Vellore. And then in Michigan, he was doing his fellowship in gastroenterology. There also we knew him. So then, when we came in 67 here, actually we were on the same ship traveling from New York we came by ship up to London. But then in London he got off and he wanted to do his MRCP. So he stayed in London. I don't know how many years it is, maybe a year or two. Finished London MRCP and Edinburgh MRCP. Then he came. And then when we were here, he was looking for places out. I think at one time he wanted to go back to CMC Vellore, and I don't know what happened, but later he called him and he said, how are the things in TMM? Is there a place there? And we said, of course, come, because we really need a medical department. We need it developed, so come join us. So that's how he joined us.
Madam, will you able to recollect the condition of our TMM at that time when you joined this one? Other than
Yes.
both of you, how many doctors, how many other departments were working at that time?
You want to answer?
I don't know.
You don't remember. Okay.
Any foreigners were there at that time?
Yes. They were foreigners here. At that time, it was a small hospital. You had the place that you have trauma center now. That was the main entrance of the hospital. And then you had a large general ward, and then you had an N ward, which was the maternity ward. So the building that you see on the side there, I don't know how to explain, that building was there, which was called the general ward and the N ward. And then we had the AB ward, and we had Anajan's ward.
Yes.
This much was there in the hospital when we came in 67.
When you came, was the theatre where the administrative
Yes,
people are
yes.
sitting?
Yes.
No, when I came, it was not. It was above.
Right.
But some of them were telling that used to be the theatre.
Yes, where the administrative building
Yeah,
is,
that's
there
right,
was
that's
one
right.
room which may have been like this size room.
Yeah.
And that was the theatre, and it was very interesting that we would go there and do our surgeries there. But then the surgical load became very heavy, and we knew that we couldn't manage with that one plane.
Theatre.
So we would put a curtain in that room, and it became 2 rooms. Because when he's doing surgery or Dr. Gilmore Davis is doing surgery and a cesarean comes, where do you go? So then we did that, and that's how it was for some time, I don't know how long. But then we realized that you need more surgical space. So that is when the building, the present
Pediatric ward.
pediatric, what is it? Building was built, and again it was architect is Laurie Baker.
Yes.
And so that was supposed to be 5 operating rooms on top and ICU in the
Ground
ground
floor.
level. Yeah, that is how it was made. Yeah, as far as people, we had foreigners then. We had Dr. Gilmore Davis, who was the superintendent, and
they from Australia.
Brian Smith.
Brian Smith,
Dr.
yeah.
Brian Smith. Dr. Brian Smith was a great gynecologist, obstetrician, and he...
So that obstetrical gynecology.
Yes, he was an obstetrician gynecologist. He did a lot for the hospital. And the initial 3 doctors were wonderful doctors. It was Dr. Mary Luke, Dr. Eliama, and Dr. George. These were the 3 people. Dr. George usually stayed in the, what did you call it that time? Not emergency, there was a casualty.
Casualty.
Yeah. Dr. George stayed at casualty. And Dr. Luke and Dr. Eliama Chaco, they were the main people who were doing gynecology and obstetrics. And I think it is not an exaggeration on my part to say that the hospital was famous for gynecology and obstetrics. And maybe people who are like 50, 60 or so, most of the people in Tiruvalla and around were born in TMM hospital.
Yeah.
I forgot to say something, a very, very important foreign doctor was Dr. Churchward. His name is still remembered by so many people. And it was actually, now it is called Sipes Hospital. It used to be called Churchward Hospital. Because he was very good and he was an old-time doctor. We didn't meet him. He was gone before we go. So all I know is what I hear about him. But Dr. Churchward was the doctor here before. And there were many nursing missionary nurses here. There was Mary Pitts, Muriel Pitts, Mary Bardsley,
Actually.
Pauline Hodgkins, Margaret Shaw. So those were all the, and there were more than that, but those are the names that come to my mind. These were the nurses that were here from England and Australia. And actually, the nursing school was started by Mrs. Churchwood. But like I say, I wasn't there, I don't know, and I don't know Mrs. Churchwood, but I've heard that she is the one who started the School of Nursing, and I can't tell you the year, I don't remember. So then the nursing school was started, and it was what you call a GNM, General Nursing and Midwifery. And then later on, others came in. One of the very person who has given a lot of their time and energy to that hospital is Sister Itti. She was the nursing superintendent for the longest time. I don't know how long, and then she became the principal of the School of Nursing. And I think during her time and Sister Bardsley's time, it became BSc Nursing.
BSc Nursing.
BSc Nursing.
So after Mary Bardsley left only BSc started.
Yes.
Oh,
sister.
okay. So
So
it was
MB
all,
ward is actually her name.
Yes.
yeah. But Mary Bardsley did a lot for the nursing department. So eventually,
Sister George was there.
Why the
Sister
pleasure
George
sit
was
there?
there.
Yeah, she was there for a long time.
She was there for a long time. Sister George used to be in the G ward
Yeah.
and private wards, yeah. There were many nurses who were quite
They're very dedicated people.
dedicated people. I can't remember all the names. There was one Sister Mary Varghese, I think. Sister Varghese, you remember Sister Varghese? Tall. And in our operating room, I should not forget, Akka.
Akka is there.
We always depended on Sister Shoshamma.
Shoshamma.
And we always called her Akka. So Akka is still here.
She's still
Yeah,
here.
Still here.
Sister
Yeah,
George.
Sister George was there for a long time.
She was there for a very long time.
Yeah.
She is very efficient.
Yeah, she was in Saudi Arabia for some time,
Yeah.
and she came back, and she was here, and yeah, she was very efficient.
She is very strict.
Yes.
Then we talk about the laboratory you established about
The laboratory.
Why you started that?
Well, when we came again in 1967, as I said, the current trauma center is where you went into the hospital, and it was casualty, and then there were two places, which was the outpatient, where the doctor sat and saw the patients. And then on the right side, there was a little room, and that was called the lab. It was just a small room. And what they used to do there was blood count, stool, and urine. That's all that they could do at that time. So that was what the lab was. But as the hospital was growing, we are doing more surgery. Then Dr. Jacob joined. Actually, it was after Dr. Jacob joined that he kept on saying, we need to have lab studies. We need to know more results of tests. Like, what is the sodium on a person? What is the potassium? Just blood study of blood count is not enough. We need to know all the biochemistry. Then, we need to know bacteriology because, otherwise we're just giving antibiotics not knowing what the organism is sensitive to. So that was the thing, and we just didn't have anything. So I had done a residency in pathology, had some knowledge. So I said, I'm happy to start a lab, but you need a place to have the lab. And at that time, Dr. Gilmore Davis was the superintendent, and he said, well, I don't know where to put it because right now we don't have any space to put the lab. And on the other side, the medical doctors especially, and also the surgical doctors were saying, we need this, we need this. And it wasn't like you have DDRC now and all that, where you could go out and do your lab studies also. I mean, if we didn't have it, we didn't have it. That was it. I mean, there was no other place they could go and do these studies. So there was no option but to start. So I suggested to Dr. Gilmore Davis that the area above the present chapel be used, and let's start a lab there. And he kindly consented. So we started the lab there. We started biochemistry, bacteriology, and blood counts. And it was interesting, in those days we couldn't even get these, what do you call them, agar, the discs or the agar. So we had to make our own agar and our own discs for sensitivity and culture, which we did. And then there was a lot of bleeding in patients. We needed a blood bank. We didn't have a blood bank. We used to just ask the relatives to come and give their blood, and if there was, we did, and otherwise it was really hard on the obstetricians and the surgeons because, blood was so hard to get. So we decided to start a blood bank. Marthoma College students were very helpful. We would call them. We had a big book in which we had the list of these people who we could call in real emergency. And then we started the blood bank. But again, today in the blood bank, you can get these plastic bags with the anticoagulant in it. There was nothing like that then. In those days, the blood bank used to use bottles. And we had to make our own anticoagulant and autoclave it and have it. And we did that. And so then we had a blood bank where we had at least some blood available for emergency. And then it was a replacement. It was given to the patient. So that was, then we also started doing, we needed a lot of IV solutions for the patients. And it was hard to get that. We could get that, but we thought we could save money by making our own. So we started making our own IV solutions, and that went well. But then after some time, maybe in 80s,
Yes.
I'm not sure, the drug controllers became more strict about the blood bank and about the IV solutions to be made individually in hospitals, and it was all regulated, and now everything is through the government. Where we had it with CMAI, we were certified with CMAI, and that's how we were doing it. But then they wanted a government certificate, and which is good. So what you have now is very good. But at the time, what was needed, we were able to provide. And we just see, what I remember of the time that we were there was the doctors, the nurses, the staff. They were all very dedicated, and they worked as a team. And everybody's desire was, to provide to the community what they didn't have within our means. And that is what was done. And I think the community was very happy to have Saib's Hospital. It has that good reputation from Saib's time. And they were happy, and it continued. And I think God gave the increase. It wasn't us. God gave the increase. God blessed. But He certainly used the hands of all the team workers. So, we ourselves may not have been able to do it unless we had this teamwork, unless we had these many, many people who helped. And I have to say also there was an evangelist, Avrachan Upadeshi. He was there right from the beginning when we were there, and he was so cooperative. When we found a person, a patient having difficulties, problems in their life, suffering, we would tell him, and he would go and pray with him and communicate with him. So there was a lot of spiritual help also that was given at that time.
I don't belong to Tiruvalla. Basically, I am from Punnaveli. Punnaveli is a small village near Mallapalli. So the name about TMM hospital was also good at that time among the people, because they don't have any other medical facilities in and around Punnaveli or Mallapalli, and people used to come to Tiruvalla. And one thing we always, as young children also used to hear, was the good nursing care TMM always had, and the efficient doctors and the foreigners. So So that was a added attraction to the people, the community. And I think people were very much satisfied with the services. And as I told earlier, the advances in the surgical techniques, like what he has introduced, the TURPs for prostate disease, was something revolutionized the medical growth in this place, and especially in this hospital.
Even today, I feel I didn't get it in the right way. There's a surgery called radical prostatectomy for CA prostate. Every time he goes to the US, he will come with one surgery. And you won't believe, one of your patients is still alive. He stands in front of our hospital. We did that case in 1992. You remember?
Cancer?
Both of us did it together. We took 5 hours. Okay. The other thing is, you remember that boy, Shanu, where you did an ectopia vesica closure?
Yes, yes. I
He's
remember.
married. He's in Australia.
Oh, really?
Yes.
Amazing.
Yes.
How God.
Yeah.
You know, that boy, I think you have to understand, that boy was born
Without a bladder.
without the abdomen
Wall.
thing here. So there's no,
I thought you will remember him.
yeah, there was no,
We did a lot of gimmicks on him.
the bladder was open.
Open.
That's how he was born. And I think he must have operated on him, I don't know how many times.
No, 5-6 times.
Not 5, 6.
We
very
did so
many
many things.
times.
Finally,
So-
we took out his rectus abdominis
Yes.
from here
Yes,
and crisscrossed it and closed it.
yes,
I don't think you will remember all that.
yes,
We did a lot of gimmicks. I was also feeling. But I met his father
yes.
a few years back. I don't remember when. I asked him, where is this guy? And he told me he has no children or anything, but he's got married. The girl's parents were told about him.
Yes.
And the girl agreed. He is in the IT field. And both of them are in Australia.
Yeah. Yeah, he was a bright boy. He was a
Yeah, he was a very bright
very
boy.
bright boy. He was a small boy, bright boy. He was in Sea Ward, I remember. And he was very fond of Dr. John. He always wanted to see him, and he was equally fond of that child.
You remember
Because he
Thomas?
always-
There's another boy, both of us operated. Thomas in there. Ectopia vesica. And he is still alive.
Yeah.
He is now an insurance agent. He comes to me, but the unfortunate part is, little part of his abdomen, this thing has given way, where we reconstructed.
Yeah.
But what I have done is now, he is now nearly going to be 50. I just put an SPC into that and just, he is living on that.
Yeah, I think there were so many very, very.
Very, very difficult surgeries. And we could not continue with the radical surgeries because we didn't have enough material to work up. Because we did totally, I think, 8 or 10 cases of radical. But out of 8 or 10 cases, 4 or 5 of them, after opening, we couldn't do anything. Because at that time, staging was not possible.
Yes.
So we went on based on the biopsy and just an examination. Now we have MRI, everything, so we can know exactly where it is. That was our biggest drawback at that time.
Yes.
So he went, Patrick Welsh.
Yeah.
He went with him and saw 1 or 2 surgeries with him. And he brought it here and we started doing.
Yeah, I think they had a very good relationship, Dr. John and Dr. Manak.
Yeah,
You know,
we
he
did.
was the first one.
Then there's another interesting case. Lot of cases we did like that, which are very unusual and very difficult.
A lot of stones.
Stones, we have done a lot in the institution.
2005, I joined TMM hospital as a urologist. I still remember Dr. Kunjappan John used to come to the theatre on Mondays and sometimes
Thursdays.
in Thursdays also. And then first thing I will ask, what is the list like? So you tell about the list, and sometimes he will change, come inside and watch. So that was after a long time, after he has left the institution, and so that shows how he was enthusiastic about the surgeries and the things going on in the urology department. So that gave us all a boost, also moral boost, to develop the department to the present level. And Dr. Manak, as you all know, is a very dedicated person, very much concerned about the patients, and gives good care, and he wants to do all the latest of the surgeries which is coming into the field of urology. That's how over last so many years the department has progressed, and most of the surgeries are done here in this department. So that is one thing about TMM, and I hope the things will continue.
ഈ അൾട്രാസൗണ്ട് മെഷീൻ ഹി ബ്രോട്ട് ദ മലയാളം പറയുമ്പോൾ ആദ്യം അൾട്രാസൗണ്ട് മെഷീൻ ഹി ഷിഫ്റ്റഡ് ഫ്രം ദർ അവിടെ നിന്ന് വന്നിട്ട് യു റിമെമ്പർ വി സ്റ്റാർട്ടഡ് പങ്ക്ചറിങ് സിസ് വിത്ത് ദാറ്റ് ബിക്കോസ് nobody knew how to do ultrasound. So both of us, he was doing, then he was looking at prostates, I was doing cyst punctures. He brought it, somebody gave it free, I think. I don't know, you brought it from there. You shipped it. Ultrasound machine.
Yeah, he shipped me. And then he brought all the resectoscopes.
Resectoscope, even that chomnoscope. Chomnoscope is what he
Pediatric
brought.
scope. I think a lot of those things you still have it.
Yeah, we still have it. Pediatric,
Use it.
yes. One or two of his scopes are still being used.
Yeah.
Then
Ureteroscope.
this bioptic gun, he brought the first one
Yeah.
from there. Now it is freely available here. Adu vechittu we were able to do a lot of cases.
And on general surgery side, I think he brought an X-ray machine.
Yeah, I
That
brought
old X-ray machine.
old X-ray machine.
Remember?
Yes.
I think it is still there. I don't know.
No, അതൊക്കെ പോയി.
It's gone.
ഞാൻ മുറിയെ അവരെ കളഞ്ഞു.
But that
There was a
lasted
huge,
for
the big
a
machine.
long time, didn't it?
Yeah, that worked for a long time.
The hospital he worked in, those people donated that machine. And that's how we got it. Yeah.
That big one, നല്ലൊരു മെഷീൻ കൊണ്ടു.
General
പിന്നെ
electric.
dialysis machine also he brought
one.
I think Dr. Jacob was handling that.
Yes.
We brought one dialysis machine and we used that dialysis machine on one lady.
No, it was the dialysis machine which Dr. Jacob was using was the one which you brought, I think.
Yeah, I think so.
That is the machine.
Yes.
Then after that, 2 machines we got.
That we didn't bring.
You didn't bring, but actually it was also donated.
Yes.
Then that time you were actually you were back in India. That is Varghese വിട്ട് train ചെയ്തു we started.
വർഗീസിനെ വിട്ട് അറ്റൻഡ് ചെയ്ത സമയത്ത്
നിങ്ങൾ കൊണ്ടുവന്ന മെഷീനാ അല്ലേ?
on that machine. But somehow or the other we were not able to get a nephrologist.
You were not able to get a nephrologist.
That's why it didn't
go on. Yes.
But there was one patient, a young lady, and she went into anuria. This was in Kangra Hospital, I think. And so it was a bad situation. And then they called him, and he asked them to transfer the lady to our hospital. And on that, because she had gone into anuria, we used the machine. That was the first patient they used the machine on. And she started passing urine. And once her acute renal failure was taken care of, then he operated. It was the ureter that had to be put together because the ureter was cut. So that was the machine that...
Here a lot of snake bites were taken at that time. Now I don't know. And that time this was the only hospital which was able to do dialysis. At that time Dr. Jacob was in charge of that.
Yes. Dr. Jacob was doing a lot of
peritoneal dialysis.
Yeah. Dr. Jacob, I think they're going to talk to him about about what things that he has done.
He has done this.
And he did a lot.
I mean,
He brought up the medical department, dialysis.
They are the ones on which this institution grew. Because of their hard work, a name came, patients came, the confidence of patients came, and on that basis, the hospital grew. You understand?
But I
That
think,
name stuck, Saipin Ashray.
yeah.
Because if you look at the patient pattern, first thing that every patient says, Saipin Ashray Kuma. But then it has changed now, there are many other hospitals. But the first word that comes through is Saipin Ashray, because അങ്ങനെ ഒരു പേര് ഇവിടെ ഉണ്ടാക്കി വരാൻ. I think that is the big thing that they have done for this hospital.
Why? Urine is beautiful because what the kidney does is reflected in the urine. And that's what is amazing about it. That the kidney is doing the job.
Urine is beautiful. Dr. John went to a meeting and I think they gave those little badges and he was wearing it on. So wherever he went, he would have this. Urine is beautiful. And I said, if you are with the doctors, it's okay to have this badge that says urine is beautiful. But when you are with all the other people, I don't know what they think of you when you're saying urine is beautiful. Because really speaking, people don't consider urine that beautiful. They think of that as a dirty thing. So, but then he said, just like he said now, urine tells you about the kidney and the work of God that happens by the kidney. So really, when you look at urine, you should remember that it is beautiful. Because all you have to do is go to a person who is on dialysis, who cannot pass urine, and he will tell you, urine is beautiful. I wish I could pass urine, and I can't, and so I have to be on dialysis, and they are on dialysis for years on end. And what a suffering they have. So urine really is beautiful. This is a great thing that God has made in our body so that we can excrete all the stuff that is not needed for the body, and it is out there. And this is the reason he said, I wear this to say urine is beautiful. I have to say a few things about Dr. Manak. Yeah, we have worked with Dr. Manak for a long periods of time that I remember when I was here. And of course, I would only see him in the operating room because, that's where I am as an anesthetist. And I have very, very good recollections of him. He is an excellent surgeon, very thorough, very nice. And, when you work with surgeons, there are all kinds of surgeons. Surgeons that are nervous, surgeons that get angry, surgeons that are very good, surgeons that are very capable. Well, Dr. Manak is one of those, The whole atmosphere is very peaceful when he comes in. Everybody is happy there. And he will, crack a joke or something and come in and, the nurses are happy, we are happy in anesthesia. And the case goes on one after the other. And then, maybe 3 o'clock and everybody's getting tired, then he adds one more. But because it is him, everybody's happy. And so it was a pleasure working with Dr. Manak in the operating room. But outside also, he has a name. After Dr. John left, he was the urologist, and he really took the department forward. And, if I say, talk to patients outside, Arya Kananode, oh, Joseph Manak. That's how they will say always. And they have so much confidence in him. The reason is because he takes time with the patients. When he goes to the patient to see, he's not rushed.
There's a composure of patients.
Yes. He may be rushed like he's rushed right now, but he will wait and he will say, and he'll listen to the story and then very gently move on to the next patient. So patients always feel that he cares, that he has their interest in his mind, and very, very pleasant personality, present personality in the OR and outside the OR with the patients. And I think deep down, he really cares for his patients. And that is why patients are so fond of him. And even when we came back, later Dr. John became his patient. Last time when we were here, and he had a urinary problem, and then I checked. I said, is Dr. Manak still here? And they said, yes, he's here. So I said, okay, then just tell him that we need to see him. And so he took care of him. So the Chela took care of the Guru.
Every year, every minute, everything is going up and up. When I finished my urology, TUR was the only surgery we were trained in. But over the years, we added so many more surgeries which we learned after we graduated. So whatever, now there are two things that we have to come through here. That is, next is the transplant program. And next, that requires a lot of coordination, a lot of effort between the nephrology department, the urology department, and also the ethics, and so many other things are involved in a transplant. Before we take the jump into transplant, the hospital will have to decide whether this is going to be feasible and worth it. Because transplant, if you take it to the next level, it's very time consuming with a lot of complications, a lot of backlashes. Because if this kidney doesn't take up, the people will get violent. But it can go like that also. There are places where a lot of problems can occur, and it requires a lot of effort. You got to look after the patient very well. Then our thing is robotic surgery. We are doing everything other than this thing. A robot costs around 8 crores.
Yes.
I think that will be a big investment. I don't know whether hospital will be able to provide it.
Other than TUR, we are planning to start Hall-up.
Hall-up is also coming.
First time in Central Travancore, we will be starting Hall-up.
Hall-up. We're going
Maybe
to buy
next month.
More later, next month we are going to buy that.
That's very good.
Laser prostatectomy.
Yes. Yes.
We're trying to
Yes.
go up and up.
Go up and up. Every time in medicine, things are just becoming better.
Actually,
and better.
if you say it in English, it's going by leaps and bounds.
Exactly.
We are not able to catch.
Yes.
We don't know where it will go.
Okay, now we will send Dr. Manak.
Yes.
Before that, sir, Dr. Pelli, can you just conclude this? Say thanks to thanks to them. We have continued to send
Actually, I have started working at TMM Hospital for the last 10 months. But I have been working with Manak sir for almost 3 years.
Yes.
So I have the experience of Manak sir. And while doing all the surgery, sir used to explain to me how he learned a lot of things from Kunjappan John, especially radical open surgeries and all. He usually always comments regarding the contributions made by sir and all.
I always used to tell him,
Yes.
dissection you have to learn from, because his dissection is perfect. I think probably he's learned it in the Western way.
Yes. He learned it from-
because he dissects very beautifully. His hands go very well. I don't think he remembers this. I always used to tell him his hands are very good.
Actually, before coming here, I was thinking that I was working in just another hospital. After coming here and hearing all the not stories, the experiences, I am grateful to work in such a hospital with a great legacy. And the urology department itself, we can trace their job starting from 1960s. I think it will be the first urology department.
That's the first urology department in Kerala.
Actually, I have already told you, I joined this institution last February. From that time onwards, we are gradually trying to develop the department. First thing we acquired right now is the best laser machine in Tiruvalla itself, best laser machine, cyberhome machine. With that laser machine, we are doing all the stone surgeries we are doing. Later, we have started the first time the sexual medicine clinic in Kerala. Exclusively our hospital is having the first sexual medicine clinic in Kerala. Now we are, next month we are planning to start the Hall-up surgery. That is, instead of started the TURB for the process. That was, at that time, that was the standard of care for prostate, benign prostatic hypertrophy. Now the standard of care has changed from TRP to whole-up surgery. That's a laser surgery.
Yeah.
So TMM will be acquiring, already given the orders. So the machine has to come from Germany. So we are planning to start the whole-up surgery from next month onwards. So every day by day, every minute by hour, we are gradually growing.
Yes. How about some brachytherapy? Did you think
Brachytherapy.
of some brachytherapy?
Yes, ma'am. And actually, we have the plans for starting
Yes.
that onco department.
Onco
itself.
department.
So already we have a
Brachytherapy
radio
will be very
oncologist right
nice.
now.
Yeah.
We have a radio oncologist. So in a few months or years or months, we will be starting that radiology department. The plans for that expansion of nuclear medicine is also in the full swing.
That's very good. Yeah. So we wish you all the best.
Yes.
Yes.
Yes. Well, thank you. Well, as I said right from the beginning, that, we human beings will come and go, but God remains forever.
Yes.
And God started this hospital. You remember Dr. V. Varghese? He gave his little clinic, and I think it was 5 acres of land or how many acres of land at that time to start a hospital in the way hospitals were in the 1930s. And look how it has come up.
Yeah.
And what a growth we have seen. And God has used human beings. But so we will come and we will go. But God endures forever.
Okay.
And
Amen.
it is our wish for TMM that God's blessings always remain there and that it go to a further height. And I'm very pleased with the present, trustees and people who are making the various decisions to not stay behind, but to proceed, to develop, to do things for the society as they need it now. And I'm really pleased to see all the growth in each department. As I said, in pathology we started with that one little room, and today the pathology department is so great, with all the machines that are state of the art. Anesthesia department has developed so much, and we have got wonderful anesthetists. So God has given the increase, and I think we must remember to give God the glory for it.
Okay. Thank you.